MEDITECH is simple to use. It's just been a very straightforward, intuitive program, and it does increase satisfaction, and I'm very satisfied with working here too.
Halifax Health is a community hospital system in Daytona Beach, Florida. We've actually been around for 90 years, and so we're celebrating our 90th birthday this year. And essentially what Halifax's mission is to care for every rooftop in our county. Now that rooftop can be a mansion at the beach, or it could actually be no rooftop because unfortunately the patient lives in the woods or has some problems in their lives. But no matter what it is, when you come to Halifax, we're going to give you the best outcomes possible.
Being in Daytona really is sometimes a challenge, given that we have so many tourists that come here for the races, for spring break and that. And it can be cumbersome to try to keep up with everything, but it really does help to have those recommendations from the program to keep us on track and keep us speedy.
I think the platform does a great job in really enhancing patient safety, including implementing the computerized physician order entry, along with having our pharmacies verify the medications that we enter, along with nursing using bedside medication verification. I feel like using all those three areas, it really increases our medication safety. The patients can definitely receive the right medication at the right dosage, the route, in the right time, with all those multidisciplinary approach with physician, pharmacy, and nursing to make sure that you get the right medication to the patients.
So as a CIO, one of my goals is to keep physicians away from computers. It may sound very odd, but the best place for a physician or a clinician to be is by the bedside. It's not typing away on a keyboard. So MEDITECH solved this problem. So what I really think that MEDITECH brought the EHR back to the patient room. So MEDITECH came out with mobility, which is essentially having the entire EHR on a tablet or an iPad.
I think the biggest boost we have is really with the physicians that have implemented the mobile technology are seeing more efficiency with their individual use.
It's nice, and speaking to the portability, I can get MEDITECH on my phone now. For instance, just last night I had a 10-year-old girl who broke her arm. It was very nice to be able to bring the pictures into the room and show mom and dad, here's before, here's after. It took the nervousness away from them and say, oh my Lord, this girl is never going to be the same. And when they saw the pictures of how straight it was now, it really helped to alleviate any anxiety they had about the situation.
You're not having to, even though your patient might change location, all of the information is still right there available for you. You're not having to go into a bunch of different areas and a bunch of different screens. It all just kind of travels, with them.
Again, MEDITECH really thought, how can we take our product and make it mobile to make a workforce more efficient? And so not only did it on the physician side, which we're seeing, we have over 100 physicians right now using WebAcute, and a lot of our ED physicians are using WebED. But our next step is really to use this point-of-care system.
I think it's a wonderful partnership. I've seen how MEDITECH has evolved as a company to have worked with such different aspects in the company. I really feel that they really put the organizations first into a partnership where they are definitely listening to their customers, what we're wanting from physicians' perspective of how they can develop technology to improve our productivity, our efficiency. I really feel like MEDITECH is listening and really working with the different organizations and the physicians.
So we're super excited because MEDITECH kind of leaped forward of the industry and said, hey, we got to get our physicians back in the room and our nurses back in the room, and they provided the website for us to do that.